Hello, and thank you for joining us today. I'm Bethany Silloway, and I'm the Rise Vermont Program Manager for Orange County. Thank you for being a part of the Rise and Walk virtual edition. Through Rise and Walk, Rise Vermont is encouraging Vermonters to walk 30 minutes, 3 days per week, and we will also be hosting health talks from some of our local professionals. With me today is Minta Trivette. Minta is a DNP FNP who practices in Gifford's primary care offices. Welcome, Minta, and thanks for being with us today.
Thanks for having me, Bethany.
So today we're going to be talking about heartburn, and we're going to go ahead and get started with our first question. What are common causes of heartburn?
So that's a great place to start. There are a few different causes of heartburn, but kind of at the core of it is a physiological mechanism. And what happens is that there's a relaxation of the closure that's between the stomach and your esophagus. And then what can happen is that the acid from your stomach will actually kind of encroach onto the esophagus, and that can cause that burning sensation. Some things that can, some factors that can affect that are stomach distension, like after having a really big meal, smoking, tobacco, and as well as some medications and some different foods.
Great. Is it true that diet and exercise could affect or alleviate heartburn?
Absolutely, yes. And maybe mostly because diet and exercise is such an important part of maintaining a healthy weight. Some foods in particular can make heartburn worse, like I mentioned. Those would be chocolate, peppermint, caffeine, and alcohol. Those are kind of the notorious ones. And then exercise, it's an important part of weight loss if you're overweight or obese. So that combined with a healthy diet is really crucial to managing heartburn.
Awesome. What's one thing that you wished more people knew about heartburn?
So actually, I think kind of building on top of my last question, your last question, obesity is actually a major risk factor for heartburn, and I think that that's often overlooked. I think we often think, oh, it's the spicy foods. Oh, I ate the Indian food last night, and so it's the habanero sauce. But actually, obesity is a major risk factor. And so we don't completely know why, but we do know that if you're able to lose some weight, then a lot of times the heartburn will improve.
Great. Anything else you'd like to add?
I would say that if you have been dealing with heartburn for a while and you're taking some Tums and it's not doing anything, definitely reach out to your primary care provider because we should probably look into it a little bit more and see if there's anything else that we can do to help manage that really irritating feeling.
Yes. Fantastic. Well, thank you so much, Minta, for being with us today. We're out of time, but it's been a pleasure having you. For additional information on the topics that we discussed today, please go to the Rise and Walk page at risevt.org. And remember to rise and walk for 30 minutes a day, at least 3 days a week. Thanks.